All right, guys, ready to start the last section. So thank you for everybody who has hung in for the last 3+ hours, however long we've been going here. The last section that we're going to be doing is talking about the patient portal and patient messaging capabilities. I know that has been another big ask of clients over the years, is an improved patient portal. So I'm excited to show you the portal that Entergy has. I'm going to start off by showing you a little bit about the administration side, just to show you a little bit of the strength of what you can do in your setup. And then I'm going to go in and show you what the actual patient look is going to be like. So let's jump in here. If I can get my keys to work. Okay. So first thing you would be doing if you were going in to start your patient portal is going into the admin side. Now in the administration of the portal, this is where you're going to define the preferences of how the portal needs to operate for your organization. Changing things that have to do with the appearance of the portal, the things that you want to turn on or turn off, because you may say, we really don't want lab results to be out on the portal. We think that's going to generate too many questions. You can turn things like that off. Or if you said, you know, we don't want to give the patient the option to request an appointment. Again, those are things you turn on or off based on what's in the best interest of your organization. So things like where you would start would be setting up the administration staff of who's going to have rights to go in and do some of the setup. So you would be going in and defining that. You would also be defining the role that that individually is going to have. What are some of the types of functions you want them to be able to do? Do they have rights to configure the settings? Yes or no? Maybe those are things you don't. Or do you want them to be able to manage the activity center? So you can decide the different things that that individual should be able to do within the portal. Some of the different portal settings, just highlighting some of these items. We're not going to go into all of them, but just some of the different options as to where you would go in and define how the portal needs to operate. So for secure messaging, you may want to indicate the different providers that want to be able to have the messages coming in directly from the portal. Now, based on how you define this too, and the different tasks that are assigned to the provider will determine if those things are going maybe to their nurse rather than actually going to them, but if they want to have themselves as an option that the user can select that Dr. Ford is the one that I'm trying to send this message to, whether that means it goes to his nurse or not. The different patient profile where I would be able to allow my users, do I want them to be able to edit their own demographic information from the portal? This is where I give them the access to do that. Also deciding whether I want them to be able to edit their insurance information. Again, those are flags you turn on or off. Appointment preferences, if I want to have give the users the ability to be able to request an appointment, I would turn that on, 1, and then 2, identify the days of the weeks that I want to give them the options and the time frame that I want them to be able to pick from. A new enhancement that we're adding to the patient portal, not available today, but I think is coming out in July, August timeframe, is actually to be able to allow the patients to schedule their own appointment. So if you've ever wanted to be able to actually have it to come up to where it said, do you want to come in at 3 o'clock or 5 o'clock, and let them actually be able to check on the appointment time and it actually make the appointment, that's something that's being added in the next release. Now that's, again, one of those things you may say, no way, my patients would make a mess. You may not want that, but you do have that option to go in and set that up. Appearance, changing the colors, the different look and feel that you want for that to be, you know, based on your preferences there, you can set that up. Prescription refills, if I want to allow the patients to request those refills for both current medications or for inactive medications, you would make that determination. So you can go ahead and set those up. Connections, enabling connections for your payments, because you can allow patients to make payments through the portal as well. If there are certain documents that you want to give the patient the ability to download from the portal, maybe there's a diabetic document, you just want to have it out there that you can refer them to, or exercises or things like that, you could have those set up. Now let's look though at what the patient's going to see when they log into the portal. Now for the portal, you are going to have to re-invite the patients that are using the Success portal to become part of the Entergy portal. So just because they have it today on Success, they will not be able to automatically transfer over. They will have to re-engage with the new portal. A question someone had about filling out medical history forms. That is something that's a new enhancement that's being added this summer as well, that there will be e-forms where they can go in and actually fill out like a PMH directly from the portal, and that data would populate back into Entergy, into the clinical record PMH. So you will have that option. There is an app that you can use on your phone as well, so there are options there. And we'll go to the patient messaging and talk about that here in just a moment. But if I were the patient, this is the screen that I would see when I go in to log into the portal. So this would be my login screen. You do have some different variations on color and all as you get into it. If this was a family account where I had multiple individual, maybe children under mom's account, I would be able to choose the individual patient. As soon as I open up the portal, the first thing I'm seeing by default is the health record, which means I've met view, download, transmit just by opening the portal for the first time, because it is viewing the patient history at this point. If I needed to review lab results, you can see that I can see the lab results displayed here if I've turned it on that I want to see that information. If there were results that were outside the normal ranges, then it also could highlight those in red for me so that I could see anything in red that was outside the normal range. If I also want to include the ability for them to request medication refills, this is what that screen would look like. They would click on the green button there, and they would then say which medication. You see, I also see where the pharmacy is that I have set up by default. If I'm the doctor, over on my task in the clinical record that we were looking at earlier for the medication refills, they would see that request come into that task. And if they decide to refill it, it's also going to send a secure message back to the portal for that patient indicating that that prescription has been renewed and sent to their pharmacy. Patient education. Any patient education is automatically uploaded to the portal, so they would be able to access that information directly from there. Any forms that you had put out there that you want to give them the ability to download, they can also do that from the portal. Now the messaging capability, this is an example of a message and being able to see I sent a question, someone responded, maybe I responded back to them, so I can see the communication back and forth between maybe myself and the nurse, so I can see that information. When sending a message to the office, you do have the ability to decide what type of message. It may be that it's an insurance question. So internally, that's not going to go to my provider, it's going to go to my billing department. Maybe it's a medical records request where I want to send a copy of my record or something like that. So depending on the type of message, that's going to be routed to different users. But that's where the message can be sent. Requesting appointments, this is what that would look like if I was requesting an appointment on a Monday or a Wednesday and I want it in the morning. And then I could type in a notation about that. If they had created that appointment request, if I'm the person that, takes care of that, I'm going to have a task show up in my task list, and then I would go in and make the appointment, and it would send that message back to the portal to the user to indicate that their appointment had been filled. You also have the ability to update your demographic data and your insurance information. If those things have been done, again, a task is going to be assigned to whoever you have in the clinic that's responsible for updating that information. So I would see that task and it would highlight for me what the changes were, and then I could accept or deny those if those are things that I did not want to do. I also have the ability to allow the patient to make a credit card payment directly from the portal as well. So a lot of new capabilities, but more than anything, just a more new, modern look and feel that's intuitive for the user to go in and engage with your patient portal. So a very different presentation than what you're accustomed to in the situation. Okay, next I want to talk to you a little bit about patient messaging. The patient messaging, or I'll tell you what, before we jump into messaging, let me see if I can knock off a few of the questions that you've been sending in. We talked about being able to complete a PMH, so you can do that directly from the portal. The portal labs would not be sent to the portal until they have been reviewed and signed off on by the provider. So until they've been reviewed and signed, those are not going to go to the portal. Will the patient get, yes, they will get an email alert if they have a new patient portal message, so they'll know to go and check it. Okay, we did not, someone stepped away. You do have the ability to use like Dragon if they want to dictate their entire progress note inside of the chart. You could have like a SOAP note format, or you could have maybe the nurse going in and doing the chief complaint and some of the details and then them coming in. You can upload pictures or insurance card through the portal, because I can attach something to a message that I'm sending. You can do broadcast messaging, and that's what we're fixing to get into here in just a moment, so we'll talk about that. The credit card payments, we do have one source that we already have tightly integrated in, and I don't remember the name of the merchant that we have that tied in, that if you're using that merchant, that payment will come directly into the system, and then you would just have to approve those. Or if you were using a different credit card company, processing company, then you would get a list of the payments that had been made through the portal, and you would manually go in there and enter those directly in. The communication from the patient, yes, will show up as tasks to the individuals that you've indicated are the ones that are responsible for following up on that type of task. And you don't have to use the patient portal at all. That is totally at your discretion. But if you want to use the portal, that is your option, and it is available in English and in Spanish. So you do have a language option for the portal. But the portal is totally at your discretion whether you turn it on or not. Okay, let's jump in and look at messaging. So we're going to look at messaging now. So the messaging capability is where I want to have the ability to send out custom messages to patient based on different types of activity. So the way that those messages are delivered to the patient can either be phone calls that the system can make with, recorded audio type. It also could be text messaging, or it could be via email. Normally, the system's going to look to the patient's preferred method of communication and determining which of those tools it's going to utilize. So back over on the patient demographic screen, you do have the option to indicate what the patient's preferred method of communication is, and that's what would be utilized here. The types of events that you would use the messaging for would be like for follow-up or for reminding the patient about their appointment. So if the patient, is scheduled to come in on Monday, maybe I want to send an appointment reminder tomorrow to tell them, don't forget about your Monday appointment. So appointments can automatically trigger different messages that go out to them. Also, no-shows. If a patient did not show for their appointment and you want to send out a text or an email to them to, remind them that they didn't come in today, you can also do that. You can have a happy birthday message that's sent based on the patient's date of birth, of course. And then you also can do broadcast messages, where I want to send out a message to everybody that's scheduled to come in tomorrow to say that, hey, due to inclement weather, we're going to have to close the office tomorrow. So I could send a message out to a group of patients as one. So you do have some different reasons that you can go in and set those up. You also could send out different messages to that same population. Like I may want to send a message out as soon as I book the appointment. Then I want to send it 3 or 4 days before. Then I want to send it the next day. So you can have different messages that are going out. Same thing with like no-shows. If a patient misses an appointment, I want to automatically trigger it. So you can go in and set up messages that are triggered based on certain types of events. Birthday event, again, tied back to their date of birth, so you can go in and send those different types. Self-service, and this is more looking at the administration of the messaging. This is where you would go in and set up the different preferences of the different tasks that you want to be included in the messaging tool. You can have different image files that are going to be part of the messages that you're sending out. So you do have some different things, like in this case, if you wanted a picture of the doctor attached to a message, you can do different things like that, and those can vary based on the provider. For the different settings, you would go in and set up the different preferences. Things like the broadcast, is there a picture? If we're indicating that our office is going to be closed, maybe there's a certain message and an image that I want to include in that. So you can set those up custom for your organization. And then based on that, you can also go in, preview that to make sure that the message you think you're sending is the one that you've actually put in correctly, and that's the message that's going out. You also have an activity center that allows you to see any messages that have been generated out of the system automatically. You can see the type of event that triggered the message. You can also go in and visually see the message that you sent. So if there was any question as to what type of message was sent out, if anybody had come in and added comments that maybe I followed up on this and I want to make a notation of something that I did, I could also see the comments there. And if I'm sending things like text out and I want the patient to be able to respond back to me, things like, yes, I'm confirming, no, I'm canceling, I need to reschedule, you would give them options, and then the system would recognize those options that link back. Same thing embedded inside of an email. I could have a confirm, a reschedule, or a cancel button embedded into the email itself. Or for phone calls, if I wanted them to be able to confirm, touch 1, reschedule, touch 2, you can have those different types of options that are built into the phone call messages also. View icon, if I needed to actually go in and see the message, I could actually bring the message up. So if for some reason I needed to reference back to what message the patient's confused, I want to actually read the message, I could actually view the message that was sent via text or via email to see what had been sent out. And the comments, if you would add the comment, you could actually go back in and see what that comment looked like, so that if somebody had added something internally, I would have the ability to go back and see that. Now, we had a couple of other additional questions. Let's see. We do have some materials. That's something that your account exec or your implementation team can work with you as far as materials that you can provide to the patient. A handout to try to encourage them to use that. Are the messages in various languages? I believe so, but I'm not 100% John, so I'm going to have to let you talk with your account exec and they can find that out specifically for you. And then screenshots of what we just went over on the portal. I know they're part of the recording today, but I can also find out if we can make that PowerPoint available to you as well. Health reminders is something that we're adding to the portal. It is not something that is available today. I'd have to check and find out whether that is in the upcoming release or the one after that, but I have seen that the health reminders will be included as part of the portal as well. And as far as any cost associated with sending out, again, I'm going to have to let you talk to your account exec. I don't know how to answer cost questions for you. But if you talk to your account representative, they can let you know that type of information. And it looks like that's the end of my questions for right now on this section. Any last questions before we wrap up? And again, thank you for all of you that have hung in with me all day. I know a lot of you have been here since we started at noon. And appreciate the questions you have. If there are things that I was not able to answer for you as we went through, I tried to answer as many of them as possible, but I know there's some that I had to defer for you to ask, maybe your account exec to follow up on for you. But if you do have specific things and you were not able to get an answer, please reach out to your account executive. Hopefully this was enough of a presentation today to allow you to have a good feel of the capabilities and some of the enhanced tools that are available for you inside of Entergy. But if you have additional questions, please reach out to them. If you need to reach out to me, that's fine as well. But your account executive should be in contact with you. If they have not been, please let us know and we'll make sure that we get them in contact with you as soon as possible. And unfortunately, we are going to have to wrap it up at this time, but if anybody has anything else, please let us know.